Fellow Guyanese, I am Dr. Karen Gordon Boyle, Deputy Chief Medical Officer, and I am here with you once again to provide today's COVID-19 update. An update of the global COVID-19 situation is as follows. According to the World Health Organization's report dated 13th of May 2020, there are 4,170,424 confirmed cases globally, with 287,399 deaths. In the region of the Americas, the number of cases is 1,781,564, with 106,504 deaths. Our statistics for today are as follows. We have tested 32 persons within the last 24 hours, and of those tested, we have no new cases. The number of positive cases remains at 113, and the number of COVID deaths is 10. Recovered cases are now 42. In total, we have tested 1,052 persons, with 939 being negative. We currently have 5 persons in institutional quarantine and 61 in institutional isolation. Our COVID-19 ICU has 3 persons. Yesterday, we mentioned that many countries managed to slow the rate of infection and contain this disease either by forceful measures or by the disciplined participation of their citizens to join forces with the government. I plead with you to stay at home, maintain the physical distancing in public spaces, wash your hands before eating, touching your face, and before engaging in activities with others. Clean the surfaces in your homes and places of work as often as possible. Reach out for medical attention when unwell, or if you were knowingly in contact with a positive case. And I can assure you that these simple guidelines will work, and we will flatten the curve. What is the Ministry of Public Health doing to facilitate you, our general public? We must thank the health workers throughout the country who are participating in the fight against COVID-19 and highlight that the results of their hard work is evident in the number of recovered cases that we are seeing on a daily basis. We must reiterate that there is no approved treatment for COVID-19. However, clinical trials are being done at the Georgetown Public Hospital Corporation, where the most severe cases are being treated. As we expand our testing, please be reminded to make use of the mobile units that are available in some communities. For the weekend and the upcoming week, our focus for this activity will be in Le Parfait Harmony on the west bank of Demerara and South Rheinveld. Please refer to our Facebook page for a more detailed location of these units. Those of you who have come forward to visit the locations in Herstelling and Paradise, I commend you for this brave effort. We are pleased to announce that very soon, residents of Region 3 and 6 will have similar facilities available for their residents. Please understand that transmission can only be reduced or stopped if we are able to separate those who test positive from those who are not infected. So we ask you to come forward, get tested, and help us in this fight. I am sure that some of you have fears about quarantining and isolation, but be assured that the Ministry of Public Health has set up these facilities bearing in mind that you are away from home, and so is trying to make you feel as comfortable as possible. The Ministry of Public Health quarantine facilities are free of cost. We provide 3 square meals per day prepared by a certified cook and team. There is a doctor and team on hand to care for and monitor you twice daily, as well as testing to determine whether you have underlying medical conditions. There are games, free internet connection, and television, telephone services to call family and friends, and psychosocial support sessions. Or the Ministry of Public Health has partnered with 2 hotels, not free of cost, to you of course, but it ensures that you have your own private space. You can have all the amenities you would like but you must remain in the facility. Please be advised that packages, except cooked food, alcohol, and drugs, can be dropped off at the Civil Defense Commission, and these will be delivered to the facility free of cost wherever you are. With regard to isolation facilities, the conditions are the same: access to free Wi-Fi, 3 meals, outdoor space to move around. If you are in critical condition, then you are required to be in the ICU and you are not allowed to leave. Now that you have a peek at the quarantine and isolation facilities, I hope this will lessen your fear of coming forward to get tested and disclosing your contacts who should be tested. This selfless act of going into quarantine is a tangible way of taking charge and protecting your loved ones. The Ministry of Public Health continues to work in the best interest of all our citizens and is depending on you to do your part. Stay safe, Guyana. Good afternoon, and thank you.